Welcome to the CCS Guideline Development process tutorial. This video tutorial explains the recommended process of using online surveys to achieve consensus on draft recommendations, values and preferences, and practical tips. This video covers why surveys are recommended, what the process steps are and how to use the survey to achieve consensus, and how to get help from CCS staff. Why does the CCS recommend this process? With the large number of clinical practice guidelines available, users find it challenging to determine which guidelines are of high quality. There is also a growing expectation of transparency, and guideline developers are expected to document and share their approach to evidence review, recommendation development, and consensus achievement. Using online surveys encourages all panel members to be involved in constructive discourse. The convenience improves participation as panel members can vote and comment when their schedule allows. The surveys improve transparency by keeping a record of the voting results, and they also aid in the management of conflict of interest by tracking when members recuse themselves from voting on conflicted recommendations. Using online surveys improves quality and transparency. Quality and transparency builds trust. It is important that the co-chairs and primary panel members agree on the definition of consensus prior to voting and preferably at the start of the project. It's common for panels to define consensus as less than 100%. At a minimum, consensus must be 2/3 of the eligible voting members. Eligible voting members is usually the total number of primary panel members. The only exception is when members recuse for a conflict of interest. Members who recuse are not counted as eligible voting members. The first step is to create the initial online survey and conduct a vote to determine the level of consensus. All primary panel members vote on all recommendations, values and preferences, and practical tips using an online survey. The survey uses a Likert scale to determine the level of agreement and allows for free-form comments. We suggest using a 4-part scale as shown. Strongly agree, no changes are suggested. Somewhat agree, I agree but I'm suggesting some changes. I disagree, and I'm explaining in comments, or I recuse because I have a conflict of interest. Depending on the size of the guideline and the number of recommendations, you can choose to use one comprehensive survey or divide your voting into multiple surveys by subtopic. Using multiple surveys may help with timelines by staggering the voting process, as some topics may be ready for voting before others. Here we see a sample Round 1 survey. It starts with instructions on how to complete the survey, explains the levels of agreement and what they mean, explains the consensus mark and what the goal is, in this case 75% as opposed to the minimum 2/3. And it explains that we're asking for the name but that the results will be shared anonymously. The name is only requested for tracking participation. The recommendations are listed exactly as worded, and the panel members indicate their level of agreement. We include practical tips and values and preferences. We can also include other things like tables and figures if you'd like your panel to vote on that. We can also include links to supporting documentation, in this example the figure, but we could also link to your evidence tables. The second step is to review the survey results and determine the level of consensus for each recommendation. CCS staff will collate and share the results anonymously with the co-chairs and the primary panel members. The panel then reviews the results along with the supporting comments to determine the level of consensus. There are 3 levels of consensus: strong, moderate, and no consensus, and each level is handled differently. There is strong consensus when the strongly agree exceeds the consensus mark. In this case, the recommendation is considered final and approved. No review or revision is required. When there is moderate consensus, when the somewhat agree plus the strongly agree exceeds the consensus mark, in this case, the panel needs to review and address the comments. There is no consensus when the somewhat agree and the strongly agree are less than the consensus mark. In this case, significant review, discussion, and revision is required. Step 3 is to review, revise, and re-vote on those recommendations that did not achieve consensus in the first round. When there is moderate consensus, the panel needs to review and address the comments. They should revise the wording as needed to address the comments. Minor edits that don't change the context do not need to be re-voted on. However, if the changes are significant wording changes or change the context, then a re-vote is required. For recommendations where there is no consensus, significant review, discussion, and revision is required. Revise the statement to address the concerns and create a new survey to allow the panel members to re-vote. When re-voting, panel members will be provided with the previous statement wording as well as the new wording. Panel members then re-vote and the level of consensus is remeasured. When consensus is achieved, the recommendation is considered approved and final. Contentious recommendations may take multiple rounds of revision and re-voting. When you have contentious issues, they may take multiple rounds of voting and perhaps conference calls to discuss. Additional communication and conference calls can be helpful for sharing and discussing concerns. If consensus cannot be achieved in a reasonable number of voting rounds, usually 3 or 4, then the recommendation cannot be included in the final document. The CCS staff is here to help you. If you have any questions on this process, contact us directly or email guidelines@ccs.ca. When you're ready, we will help set up the surveys, track participation, we'll collate the results, and we can help you schedule conference calls or connect you to a Guidelines Committee liaison if needed. Thank you for your attention. If you have any questions, please contact us.